Welcome. This training is brought to you by the New Hampshire Training Institute on Addictive Disorders. You can access the recording of this webinar on our website at nhadaca.org within our webinar library. After completing this training, please complete the quiz and evaluation if you're interested in receiving a certificate. You can find the quiz and evaluation on our website next to the Watch Now button you selected to view this webinar on our website. If you're a member of NHADACA or NADAC, the certificate for this webinar is free. If you are not, the fee is $15. You will receive a certificate worth 1 CE once you have completed and passed the quiz and paid for the webinar, if applicable. Through the New Hampshire Training Institute on Addictive Disorders, this 1-hour event is pre-approved by the New Hampshire Board of Licensing for Alcohol and Drug Use Professionals, as well as NBCC. If you have any trouble viewing the webinar, audio problems, or any other technical questions, please contact us at 603-225-7060. Please email any questions regarding the material you see today to training@nhadaca.org. Thank you, and now the training.
Anyway, we're going to talk about tobacco. TUD is tobacco use disorder, and tobacco-related disease. Those are three different things. And we're not going to talk about actual treating tobacco use disorder. That's really another hour's discussion. And for disclosures, I know that when I talk with docs, we have to give disclosures. I have no financial disclosures, but I had a lot of help, and I'm not going to go through all the alphabet soup there, except for one, since you got my name through Breathe New Hampshire. I'll mention them. They are the oldest voluntary not-for-profit health agency in the state, 105 years old, and they have had about a half a dozen or more names over those 105 years, but the mission has remained exactly the same, committed to eliminating lung disease, improving quality of life for those living with lung disease in New Hampshire. And today we'll be talking some of the things that they act on are in the picture here. We'll be talking about tobacco issues, including vaping and e-cigarettes. So here's our agenda, and we'll go right ahead, and we'll start with the numbers and what the problem is relates to the numbers. And Dr. Koop, who I've worked with until he passed away several years ago at age 97, after his retirement, he came back here to New Hampshire, where he went to college and started the Koop Institute up at part of Dartmouth Medical School and the North Cotton Cancer Center. Anyways, he said back 35 years ago or so that cigarette smoking is the chief single avoidable cause of death in our society. And unfortunately, we don't have to change that at all because it's still, I would just say it's the most preventable cause of premature death and disability in our society. And just some numbers over the years, I like pie graphs from let's see, I still have everybody up on here. Pie graphs from about 25 years ago. The red is the tobacco-related deaths from 15 years ago. The gold is, the blue is tobacco-related deaths. And diet and activity came in second. That was felt to be an overestimate when they did it. So, but the point here is that there's been over 400,000 deaths yearly for since the 90s, since it's been counted actually. And the reason for that is it's a cause of death from cardiovascular disease, cancer, and lung disease. And see the right-hand part of the slide, it really affects every organ in the body, causing cancers of all types, causing all types of chronic diseases. They have pneumonia as a chronic disease in this cartoon, but that's probably more of an acute disease, although there are chronic pneumonias that causes as well. And just quickly, the Surgeon General reports have come out from 1964 through this year, or actually through 2020. And tobacco actually affects every organ system in the body. We're not going to go through all of them. This is from 15 years ago, the Surgeon General's report. Here's from Public Health England 2 years ago. Again, affects every organ system in the body. So everybody should be interested in this. And unfortunately, this is 2020 data. There are still over 480,000 deaths related to tobacco related disease. That's smoking, mainstream smoke, and it's secondhand smoke. It does not include third-hand smoke. It does not include anything from other tobacco products, including vaping. And it does not include just suffering with tobacco-related disease. And that has, so it's been over 400,000 deaths yearly since the late 1970s. And this is, I think once things make cartoons, they've met the mainstream. And this is a cartoon from 1994. And it shows the tobacco, big tobacco saying it, that their business isn't easy because how else do you make a profit after killing 400,000 people every year? And that's from 1994. Some data from more present and for New Hampshire. In 2020, tobacco-related disease killed 1,900 New Hampshire residents, and not to diss opioids or COVID-19, but as you can see, the data that we have there, the last several years, opioids have been between 400 and 500 deaths a year. And for the 13 months from March of 2020 to towards the end of March of 2021, 1,217, it's still under 1,300 deaths from COVID in New Hampshire this year. I did not have New Hampshire numbers for alcohol or obesity and activity, but the USA numbers for alcohol between 85 and 110,000 deaths a year since the 1980s. Obesity and activity, about 200,000 deaths a year. And I have all of these referenced on the slides. I will tell you when I have good vetted data and when the data is still a little bit suspect. Can't talk to anybody this day and age without mentioning COVID-19 and the interactions with COVID-19. China came out with a Chinese medical journal in January 2020, feeling that smokers were 14 times more likely to get severe disease and death from COVID-19 if they were the non-smokers. And then the Journal of Adolescent Medicine here in the US came out with an article about 8 or 10 months ago that vapors were 5 times more likely, and dual users and smokers. Dual users means vapors who also use combustible tobacco, 90% of that is cigarettes, are 7 times more likely to get severe COVID, in other words, landing in the hospital and the ICU and death. So obviously this affects the lungs. And then about a year ago, first the University of California, San Francisco, Dr. Glantz, and then the Mass General Children's Hospital came out saying that COVID was, if you vape or smoke, you are increased risk for getting severe COVID. Just to be fair and balanced, the Association for Smoking and Health, ASH, which is a international association, but the UK one did a survey with the University College of London. In the first 4 months from March to July of 2020, it seemed that COVID was an impetus to quit smoking as 1 million people quit, another almost 500,000 tried. But as the pandemic went on, it turned out, and I'm sure you guys know because you take care of this, you saw much more stress, anxiety, and loneliness. And we don't have complete data, but what we do have is that there's many more tobacco products were being sold nationally and in New Hampshire. And New Hampshire data just from last week, tobacco revenue was up 20%, kind of saved the budget for Governor Sununu last year. That's not the way we want to save it, but they did. Lots of reasons behind that, but COVID seemed to be one of the main ones. And for vaping, the vaping went up 235% in revenue from vaping taxes between fiscal year 20 and fiscal year 21. Just to be again complete, there is some data, but it's conflicting, so it still needs a lot of research. That nicotine alone, and I'm going to talk mostly today about nicotine, that's what we'll spend most of the time on. Nicotine alone may have some good effects on getting COVID-19, but we're not totally sure that there is some physiology behind that. And like any drug, nicotine has different effects at different doses. So that's something to keep an eye on for the future. And that is just death. So death is a very hard endpoint. So the data is very robust. But how about suffering from tobacco-related disease? For every person who dies, about 8 people suffer from tobacco-related disease. So that's 20 people suffer from tobacco-related disease. So that's 8 to 10 million more people suffering from tobacco-related disease. I'm not going to talk a lot about secondhand smoke, but our 480,000 deaths does include about 50,000 deaths from secondhand smoke. So I like to call it involuntary smoking, and everybody knows about smoke-free restaurants and bars and public buildings. I just want to mention that law in New Hampshire is at jeopardy this year with our state legislature. I don't think we're going to overturn it, but keep tuned because they're trying to get their foot in the door. In other words, smoking back into places where you can eat and drink. In any case, I call it involuntary smoking at all ages and want to stress that this happens to the fetus and pregnant folks. And this is data from 20 years ago. Increased risk of low birth weights, preterm deliveries, infant deaths, including SIDS, is related to the mother smoking while she's pregnant. And it's been shown and then verified that there's 4 times the incidence of negative behaviors in toddlers when their mothers had smoked when they were pregnant. And then from Public Health England, just 2 years ago, they also included respiratory conditions, upper and lower, as well as obesity and diabetes in offspring of folks who smoke while they're pregnant. The good news is most pregnant women, without even being told, try to quit smoking, but we need to help them get the rest of the way, because here's one, again, it makes the lay press. Respiratory therapist I worked with for years gave me this. This is old, obviously, from 15 years ago or so. Roanoke, Virginia, here's a woman who said she worries about the effect of her baby on her unborn baby on of the sound of jackhammers going on with construction. But as you can see there, that she is smoking. So a lot of education needs to be done. And next, we're going to go into disparities. We've heard a lot about that this year, and this certainly relates to your group in spades, because those with serious mental illness have a prevalence of smoking of more than 40%, whereas the general population is around 15%. And also for those with substance use disorder, they also have tobacco use disorder, which I'm going to try to make the case as the substance use disorder leading to all other substances. And we know we have data on that since the 90s that relates to alcohol, opioids, and a little bit less robust methamphetamines. And the least robust is to the THC component of cannabis. But there's data on all of that tobacco use disorder leads to these others. And the disparity here is the serious mental illness group of patients and the substance use disorder group of patients. But also those who are in Medicaid, so it's discriminatory there as well, have a much higher incidence of tobacco use. And Obamacare, here's a before and after Obamacare, what's covered for tobacco cessation, smoking cessation. There are 9 treatments, including individual and group counseling, and that includes quitline counseling over the phone, as well as 7 medications. And 6 states covered all of that before Obamacare. 10 years later, 15 states covered, more cover it now, about 25 do now from between 2018 and now, but it's with all kinds of barriers. I'm retired from pulmonary critical care practice, and I can tell you the barriers put up even by our own Medicaid system, which we contract with private insurers for our managed Medicaid, and they put up barriers, although by law they have to cover it, and they will, but you have to get through the barriers. Most of them are prior authorizations and copays, which are not allowed by law. Other disparities, and this was a surprise to me, these are both CDC infograms, but the kids who use highest use of tobacco amongst youth are actually Native Hawaiian, Pacific Islanders, American Indians, Alaskan Natives, and multiracial youth, which is a little bit of a surprise to me. But even, and I think this thing in the news right now, literally in the last couple of weeks, is the menthol story, although it's been around for at least 25 years. And I call it the 80-80 story. African Americans were advertised to use menthol cigarettes because they're less harsh and easier to pick up and harder to get off of. And so more than 80% of African Americans who smoke use menthol tobacco products. And the other 80% is kids. Kids like flavors, and more than 80% of kids who use tobacco products, they first start with the advertising of flavors. We'll show you a bunch of those as we go along. And how this relates to nicotine, we'll go into, because once all of these have nicotine in them, and we know that 80% of those who are addicted to nicotine were addicted by age 18, 95% by 21. And there's some data that we have that 99% are addicted by age 25. But that all relates to the physiology of the brain, which we'll get into in the second part of our discussion today. So a little bit more, some what I call tidbits of epidemiology or disparities, but we already said obesity and inactivity is the second leading cause of death. It is, but it's about half the number of tobacco disease-related deaths. Alcohol is a distant third, alcohol-related disease, a distant third cause of death in our country. But more alcoholics die of tobacco-related disease than of alcohol-related disease. And a couple other things that people may not be aware of are more people die of COPD, that's chronic obstructive pulmonary disease, bronchitis, and emphysema, than of breast cancer every year since 2000. And another disparity relates to women. More women die of lung cancer than breast cancer, not to just breast cancer, but for the last 35 years. And more women die of COPD than men this entire millennium. And those are things you just hear a lot about: breast cancer and diabetes. No problem with that, but we need to hear more about tobacco-related disease. Tobacco-related disease just somehow doesn't get the press. It's one of the shame and blame diseases like COPD and lung cancer of the different cancers. So unfortunately, the equal rights movement for women has come a long way. Here's a Virginia Slim ads, "You've come a long way, baby." And women were specifically targeted by tobacco companies because they're a huge customer base, and they've gotten there. Last, we'll talk about kids. Last in this section, we'll talk about kids and vaping. So e-cigarettes, vaping, and ENDS. ENDS is what the researchers call vaping or e-cigarette devices. It's electronic nicotine delivery systems. And we'll talk about the numbers, and I think the numbers tell a good story. Between 2017 and 2019, where we have our last complete data by the end of 2019, there was the largest increase in substance use that ever since it's been followed by the CDC. And that substance was nicotine, and it was in kids. And it went from over 3.5 million to over 5 million kids using tobacco products, and 90% of that tobacco products was vaping or ENDS or e-cigarettes. Essentially losing all the improvements we've made over the previous 20 years from 2000 to 2019 in reducing youth tobacco use. And the problem there is nicotine, and we'll get into that. The CDC has 11 surveys that relate to tobacco use, 3 that relate to youth tobacco use. 2 of them you may have heard of: the Youth Risk Behavior Survey and the National Youth Tobacco Survey. And they like to compare one to the other to make sure that the numbers are real and they're validated. And by the end of 2019, kids know that cigarettes are bad for you. They know they smell. They know that they're a problem. And it was well under 10% of kids of high school age using cigarettes by the end of 2019. But unfortunately, you see this other graph, and e-cigarettes took off, leveled off because they didn't really give you the kick that cigarettes did, and then took off again somewhere around the end of 2016, 2017, and then just went all the way up to 27.5%, as you see there, of high schoolers using tobacco products by the end of 2019, over 5 million, and 90% of that was vaping products. Busy slides here, but from the National Youth Tobacco Survey in 2019, you can see cigarettes in high school and middle school, both very low, 2.3 and 5.8%, as opposed to 10 and 27% for middle school and high school students using e-cigarettes, which is really amazingly high, as I'll show you. The 2020 data, these are the infographics from the National Youth Tobacco Survey. And the thing to see here is that the National Youth Tobacco Survey in 2020 said we made some inroads in this. It's gone down from 27% to about 20%, at 1.7 million less. But unfortunately, their survey was cut short because of COVID. And the Modifying the Future survey, which is sponsored by the National Institute of Drug Addiction every year. That's the third survey that we use to check each other's surveys, showed that it didn't continue to go up, but the level of use in 8th, 10th, and 12th graders remained the same. University of Michigan does that every year with the sponsorship of NIDA. The big thing on this slide to look at is the dependence on nicotine. So those still using, were using it much more. So using it regularly is once a month. For moderate drug dependence, you use it weekly, and weekly or daily use was 22.5%. Weekly use was almost 39%. So of the 20 to 27% of high school kids using nicotine products, primarily vapes, almost 40% of them were severely addicted. They have severe drug use disorder, and in this case, tobacco use disorder related to nicotine. The last data that we have, full data for New Hampshire, was the end of 2019, and we were the highest in the country for tobacco use. And again, this is almost all e-cigarettes. Remember, the country was 27.5%. We were 33.8%. And it was almost all Juuls, to the point that some kids just thought Juuling wasn't vaping or tobacco, or they didn't have to worry about it. But Juuls have tons of tobacco in it, tons of nicotine in it, I should say, more specifically. But Juul pre-filled flavored cartridges were taken out of convenience stores in October, November of 2019, and use went right down, but it was replaced by disposables going up 1,000% in New Hampshire and across the country. So keeping up with the tobacco industry, in this case, the vape part of the tobacco industry, is not easy. And this relates really all to kids, which is why I'm going to stress that. And this in turn relates to the physiology of the brain, which we'll talk more about in the second part. So when you get to be my age, I'm well past the 65 plus, we don't even know what this is all about, just like we don't know about Zoom and stuff. So I see you all there on the side, and I can't see my whole slide, but I don't need that. The 18 to 24-year-olds went up between 2000, this is 2016 data, and you see in black 2018 data. And but again, once you get past 25 years old, this is not nearly as big a problem. Plus, it's used for different reasons. It isn't used to get started and then for fun and games, but it's used to try to help get off cigarettes. And we'll talk about that before we finish. So by the numbers, tobacco use is still an epidemic. It's an epidemic among youth. And if we're going to eliminate tobacco-related disease, tobacco use disorder, we have to start with kids. It's a pediatric disease. So this is about nicotine and tobacco use disorder, just about hopefully to show you that why we feel nicotine is a gateway drug to other substance use disorder, and why the combustible cigarette is the best delivery device of medicine known to mankind right now. So nicotine is an addictive drug, and I hope to convince you that tobacco use disorder, in other words, nicotine addiction, is the gateway drug to other substance use disorder. And that's not new. Here's a definition of addictive drugs from DHHS from 1997. I'll show you the one from 2019. It has 6 bullets instead of 4, but they just break out, creating dependence and compulsive use. You'll see about that. And nicotine met all the criteria for an addictive drug back in the 90s. Which is why people use it even when they knew it was bad for them, because they needed that nicotine hit. One of the criteria is relapse rates, and in the 90s it showed that inhaled nicotine through smoking, so it's inhaled nicotine through smoking, had equal relapse rates as intravenous heroin, and both were a little bit worse than ingested alcohol, but they all had bad relapse rates. Nicotine itself is found naturally throughout the plant kingdom, but it's in the tobacco plant. It's the only cost-effective source of nicotine. Now, I put up there question mark synthetic this year. Puff bars, the disposables that have taken off all their Me Too disposables. But Puff Bar specifically says they've made synthetic nicotine, so it's not a tobacco product, but they've shown no data to show how they did that. So they're trying to get around the regulations of tobacco products, but we'll see what happens. But keep an eye open for synthetic nicotine. Nicotine is a drug, so in different doses, it has different effects. This could be a stimulant or a sedative, but we know it's highly addictive. It can change the brain forever. I do a lot of testifying at the local level here in Nashua and Concord, but I've also testified at the national level in Washington, and you always get from the convenience store owners, the convenience store associations, the national ones, well, there's nicotine in everything. And I put down just because they're two of my favorite foods. Yes, they are in nightshade plants, and you all know that tomatoes and eggplant are fruits and not vegetables. But I love tomatoes and eggplant and things made from it. Mostly, I think, because my wife's a good cook. But in any case, this is the response to that. The 1 milligram of nicotine you get to the brain from one cigarette, you would have to eat 48 pounds. And as much as I love eggplant and tomato, I could not eat 48 pounds in 15 to 30 minutes to get that milligram of nicotine to the brain. So that takes care of that argument. A little bit more about nicotine. You inhale it, it's pumped through the system by the heart, it's metabolized by the liver, it's excreted by the kidneys, but we're going to talk mostly about the brain in a moment. This is from Public Health England 2 years ago. Again, unbelievably, 40% of smokers felt that nicotine was the cause of cancer, lung disease, and cardiovascular disease. It's a co-carcinogen. It does affect the heart and the vascular system, but it's not the main cause of those three major killers of tobacco-related disease, but it's the addicting substance. So this is what nicotine does. I will actually say, for those who think smoking does help control their weight, unfortunately, there's physiology behind that. It does reduce hunger pangs for an hour. It increases use of calories and it decreases absorption of calories. So it does help with weight. But the big thing here is how it works in the right dose. And that's key, in the right dose on the central nervous system. Here's a drug that at the right dose reduces anxiety and stress at the same time as increasing mental acuity, alertness, and a feeling of well-being. So you don't get OUI or DUI with this. You're not impaired when you have the right dose of nicotine. So this is a great drug, and it's not very sexy because you don't have car accidents or stuff from it. For those old, I don't play golf, but for those old enough to remember Arnold Palmer, he always took a huge drag on his cigarette, very carefully put it down on the green before he took a putt, because that would get his alertness and acuity and everything and relax so he could make a 38-foot putt. I think that's a long putt. Again, I don't play golf, so. But nicotine in the massive doses of nicotine we see now in e-juice, or in the e-liquid that are used in e-cigarettes can actually be poisonous. So a 50-pound or less toddler or pet, a half a teaspoon, 2.5 cc's have been fatal. And the result of this is that the Poison Control Center of America has been seeing a huge increase in calls across the country for nicotine poisoning, less than 300 a year back in 2011. And before even the supermassive doses of nicotine we see in e-juice now, almost 4,000 calls in 2014, and it's just continued to go up. So why is this so addicting, and why do I think it's or many, not me, but the data shows it's a gateway drug. So an average smoker smokes a pack a day. An average pack is 20 cigarettes. Average cigarette goes through 10 puffs. So 10 times 20, you get 200 hits of nicotine a day, and you get that within about 10 seconds. You can't do that with even intravenous heroin, although that's probably, it's shown that that's certainly as or more addicting, but you get 200 hits within 10 seconds. That's the key. So that even if you're a 10 cigarette a day smoker on the left-hand column for 5 years, you have 182,000 hits. So you can't afford or do that much intravenous heroin. And I guess some drinkers do, have two cases of beer a day or quarts of wine a day, but you can get more nicotine more easily than just about any of the other substances. And then a more recent data suggests with heroin as the intravenous heroin as the major addicting drug, nicotine is right in the middle, not quite as addicting as heroin or crack cocaine that's snorted, but perhaps slightly more addicting than ingested alcohol or barbiturates. But the big thing on this slide is part of the withdrawal. And a lot of people, especially during the pandemic, and especially kids, have used nicotine products to reduce, because it reduces their anxiety. And the problem with that is that as the nicotine is metabolized, you get a double whammy of anxiety, because one of the withdrawal symptoms is anxiety. And a lot of the pediatricians feel this is why the kids who get hooked are having such a hard time with it. I don't have to tell you guys much about this. The reward center, the nucleus mesolimbic brain altogether is a reward center. The ventral tegmental areas where the nicotine receptors are. But the biggie is the nucleus accumbens, and that's where dopamine is released, and that's where all of these drugs work. Uh, you can see them here listed. So dopamine is the feel-good drug that comes out. Serotonin's involved here too, but dopamine's the one to remember. And for nicotine, they know that with a certain level of nicotine exposure, there's increased nicotine receptors, and it leaves an indelible memory of effects on the reward system, so that even after stopping for 10 years and your receptors have attenuated a little bit from where you started, they never go back to the way they were. That brain changes forever, and with some external clues, you evoke craving. And so, and this is true probably for the other drugs that you more often see and are more sexy to treat. So the nicotine, the combustible cigarette, inhaled nicotine through combustible burned tobacco, cigarettes and little cigars have been studied as well, is really the best delivery device of a medicine that we know, because it's individualized precision medicine. The smoker can totally control his dose so that he gets those good effects we talked about and doesn't get the toxic effects that we're seeing with e-juice. And cigarette manufacturers knew this from the documents they had to release in the 90s when they first tried to regulate this. They knew this since the late 50s, early 60s, before the first Surgeon General's report. Get a lot of nicotine into the brain early and you have a customer for life. They didn't mention that that customer's life, more than 60% used as intended, would die prematurely. So the other thing about inhaled nicotine is that the half-life is only 2 hours. So that within 2 hours, you start getting some of these withdrawal effects. So the anxiety you were treating successfully with your cigarette, within 2 hours starts coming back, and you get double whammy anxiety from withdrawal and your anxiety baseline that you had. So you do more. So it's very easy to get hooked. Here's an old slide of nicotine plasma levels. And just to point out, the blue is the cigarette, gets a high level very quickly and then wanes over 2 hours, as opposed to the red line there, which is a nicotine patch. And a 21 milligram nicotine patch is for someone who smokes 20 cigarettes or a pack a day. You only takes 2 hours to get a level that's half the peak level of the plasma level of the cigarette. So if you're going to treat smoke, the one word about treating tobacco use disorder, smoking cessation, anybody can treat this. Counseling, either individual, group, or on the phone, is a key part of this. And the more intensive, the better. More than 10 minutes is felt to be intensive by DHHS. You all probably wouldn't think that's intensive counseling, but in any case, it is for tobacco use disorder, smoking cessation. And you should add a patch, the appropriate dose patch into the patch. That's your maintenance medication. These are all over the counter. And then you should add gum or a lozenge for as needed for when the craving comes. And then if they can do something else for 10 to 20 minutes while the lozenge or patch takes effect, they can get past that craving. So the patch is the baseline, the faster, but not as fast as cigarettes, acting gum or lozenge or nasal spray or inhaler. Those are prescription drugs, are what you use to help someone. And that's the baseline I've used my entire career, or not my entire career, since the 80s, since the NRT, nicotine replacement therapy, came out. And it has really helped well over 50% of my patients become recovered smokers, non-smokers. So the 2019 nicotine dependence criteria for addictive chemical are listed here, and all they did was add drug reinforced behavior to psychoactive effects, and they split out physical dependence from compulsive use. But again, you have the recidivism and the relapse rate and the withdrawal symptoms. And again, I think a picture tells 1,000 words as we come to the end of this part. And this is the guy's back. This is his backbone here. This here is what's called a bronchopleural cutaneous fissure. It's a hole from the lungs to the outside, as he had a cancer cut out. And he actually also had a permanent tracheostomy. So he'd love to inhale his cigarettes through the trach in the front, which we weren't allowed to take pictures of, and then blow it out his hole in his back. And the amazing thing back then, the PX, I don't know if you've been in the survey. Anyway, the PX flood at the Jamaica Plain VA was on the same floor as the pulmonary floor. This picture was taken in the men's lounge on the pulmonary floor, which was gray with smoke. This is back in the mid 70s when I was full time there. Amazingly addictive drug. He knew how bad it was. He knew he was never going to leave the hospital, but he still had to get his fix. So with that, and with people dying prematurely, we have to get kids started. So here's one of the 3 dead Marlboro men starting a kid, or say the tobacco industry called in their documents replacement smokers. And so we're going to talk about nicotine in youth now for a little bit. Nicotine has been shown to disrupt the growth of brain circuits that control attention, cognition, learning, impulse control, mood, susceptibility to psychiatric disorders. These all may be important to you. The biggest one to me, though, is the reward system, which makes them susceptible to other substances, alcohol, opioids, and now there's been data on marijuana. One study you see on the bottom said the kid's brain, the developing brain, is so uniquely susceptible to nicotine that 2 cigarettes, 80% had those changes I showed before in the brain, so that they were indelibly changed forever. Most of us don't say that. The robust data suggests, and most of the pediatricians and pediatric addiction specialists will say several cigarettes a week for several weeks will change the brain forever. In relation to a fully developed brain after the age of 25, you need those same number of cigarettes every day, not a week, but every day for several weeks to get the changes of the brain that are forever. This is a slide from Dr. Chatty, who when I knew him, he was down in Boston, but he's leads the pediatric addiction program up at McGill now. And the long-term effects of nicotine on the teen brain are these, and he includes increased risk for nicotine addiction, marijuana, alcohol, and cocaine, as well as the other ones that we've already mentioned. And just a little bit about the brain development. It develops from back to front, and the last thing to develop over here on the right is the frontal cortex, which is a center for judgment and decision making. And this is from Dr. Levy, who runs the addiction program at Boston Children's Hospital. We get our coordination first, we get our rewards, the limbic system second, and it's supposed to give you that dopamine when you do good stuff, like get good grades, or have fun exercising, or playing outside, or eating the right food. But unfortunately, drugs will get some of that reward quicker. Then emotions, and then finally you see in the lower right-hand corner the prefrontal cortex, which is why this 16-year-old driver is texting and feeling there's no problem with that. There's just the judgment just isn't there yet. And Dr. Levy, it's one of her slides, calls this the rational thinking gap. Your pleasure and reward center is fully developed as a teenager, but your rational judgment making center isn't developed until you're an adult. And this is how kids are supposed to grow and learn, but we don't want them to learn about drugs first. Again, one of her slides, that kids are developmentally primed, susceptible, and vulnerable to substance use. In the upper right-hand corner, it shows that if you can keep kids off substances until their brain is almost fully developed by age 21, you reduce substance use disorder by 95%. If it's 26 and older, which is what we really want, then it's by 99%, but I'll take 21, and that's certainly better than 18. And none of this data is new, and it's all been reproduced. This is a slide from the 90s from a Dr. Hudziak up at UVM, as a child psychiatrist, and others have reproduced it at University of Wisconsin and Stanford to show that nicotine was the first drug used. Then they went on to intravenous drug use, alcohol, cocaine, and amphetamines, not the other way around. And data from UCSF, again, 85% of their OUD patients were also smokers. And more data on going on from vaping to smoking. These are all for e-cigarettes and vaping to other drugs, marijuana, alcohol, and other drugs. So a stock picture from the 90s of teenagers. And now we'll talk a little bit about what one of the folks questioned about OTPs. That's other tobacco products, including, especially we'll hone in on vaping products, because that seems to be what's taking over. However, this is the first tobacco device, and I won't take the time to read this, but it's a tobacco smoke enema used during our revolutionary days. And unfortunately, our politics is handed down from administration to administration. It's bipartisan. And if you look on the bottom, it's where that figure of speech came up about blowing smoke up once. Anyway, we'll go on. Here are some other tobacco products. They're not all of them. They're a very innovative industry. The kretiks and biddies are from the Middle East and South Asia. A lot of the snus and things come from Scandinavia. The ones to really look at, the hookahs, of course, people know about, and what they're called water pipes here, and that makes them feel like water vapor, like from the vape industry, that's benign. But water pipes have been shown to give you as much disease as combustible tobacco, because you are actually inhaling what has been combusted tobacco products. The biggies to look at here are the heated products and the e-cigarettes, and we'll show you a little bit more of that as we go along. Look up here on the right, you'll see little cigars. And look at the flavors: grape, strawberry, pineapple, peach, and wild apple. Who are they advertising to? Then you have coffee cream down there. They're advertising to kids. And this is a question for the next chat at the end of this section. And what is the difference in definition between a cigar and a cigarette? And why is it important? I'll tell you why it's important. You tell me the difference. It's important because our laws have a huge loophole for cigars. So they're not taxed and they're not regulated the way cigarettes are. And e-cigarettes are somewhere in between right now. But how do you define a cigar versus a cigarette? That's the question. So here are some of the other tobacco products to be of concern. A couple of points on this. The IQOS in the middle is I Quit Ordinary Cigarettes is what it stands for. It's a product by the same company that makes Marlboro, formerly Philip Morris, now called Altria. And they also own a big part of Juul, and has 25% of the market in Japan. Right now it's marketed in just 2 areas, Atlanta and one other. And they're trying to get approval from FDA to say they're modified risk reduction, but their first set of data did not show that. So they're just being marketed as what's called substantially equivalent to cigarettes. But they say all their marketing suggests that it's safer. On the left is a Zyn. It's made by the same people who make Snus, a Swedish company. And they, in one sentence, they say this is a tobacco-free nicotine, spit-free and tobacco-free experience, and they get their nicotine from tobacco leaves. So how is that tobacco-free? They still get their nicotine from tobacco leaves, which is the point. It's a tobacco product. So e-cigarettes, what are they? Well, there's hundreds and hundreds of brands. All of them have these similarities. They have an energy source, which is a lithium battery. They have a heating element, like the coil you see there, and they have e-liquid. The battery is triggered by inhaling, and then it heats up the coil, and then it heats up the liquid and makes an aerosol. Here are the generations of e-cigarettes. We'll go through that in a bit. The aerosol is not vapor. It's not like steam coming out of your teapot or out of your simmering soup. Aerosols are made to bring chemicals into the body, and this does a great job of bringing chemicals, including nicotine, which to me is the big one, down deeper into the lungs, into the rest of the body and the brain, as you saw in 10 to 20 seconds for e-cigarettes, and even metal particles. Some of the medical particles from the heating coil have been shown to be brought into the body. And they all have volatile organic compounds, about a half a dozen more cancer-causing chemicals, and flavoring like diacetyl for buttered popcorn. You see there's something called popcorn lung. We don't know the long-term effects of all these, but they certainly can't be good. You've seen the big plumes of coming from people using vapes, at the corner or standing at a light, coming out of the car window. Well, if they do it out the window, because if they do it on the window, it gets stuck there. It's sticky stuff. It smells good and tastes good. But think of it sticking on your bronchial tree. It's got to be irritating. All I can say that is it makes sense. It's irritating. We don't have all the data on that yet. And researchers at Stanford and Yale have come up with about anywhere on the average 60 to 100 components. That's a lot less than 7,000 in a combustible cigarette, so it's probably not as harmful. more than a half a dozen human carcinogens, that's less than 70, so probably less harmful than combustible cigarettes, but they all have nicotine. A study by CDC showed that in a convenience store, 99.5% of e-juice tested had nicotine, no matter how much nicotine or little nicotine was advertised, because it's not controlled here. Floyd wanted me to talk about some of the vocab. So we'll talk about nicotine salts and cloud chasing in a little bit, but we'll talk about dripping and dabbing now. Dripping relates to the modifiable third generation e-cigarettes, where you could take them apart and drip the e-juice right on the heating coil you see there, and that makes a thicker vapor, and you get a higher hit of nicotine that way. Unfortunately, it also was a cause of burns, and the third generation, which had a much higher voltage lithium battery, was the source of explosions and spontaneous combustion and health harm that way. Back in 2016, about 30% of youth who use vaping products also use marijuana substances, mostly THC. And by 2021, Parents Against Vaping E-Cigarettes is paved down there. You see referenced, that's up to close to 60%. And another new thing that's coming out are so-called wellness vapes, and that I should have put quotations around that. But they say you're vaping vitamins, essential oils, and things like that. But we have no idea when these things are heated, even if they're FDA approved, just like the flavorings in e-cigarettes are FDA approved for ingestion. But when they're heated or even left on the store, in the storage, I'll show you some of the stores, they will go through chemical reactions and change, and they become very toxic. Dabbing is primarily relates to marijuana, and obviously that's another whole talk. But the points here to be made are that these are marijuana concentrates, have a lot of names: BHO, honey, oil, butter, shatter. The idea is to get more THC, and the levels of THC when this slide was made are up to 40 to 80%, and now some have been found over 90%. And just as reference from our dispensaries, the highest THC levels in those products are 20%. And from my own reference from Woodstock years back in the 60s, where I was part of, the best, if we really got good marijuana, it may be 8 or 9%. Most were 2 to 4%. So this is not your grandmother's marijuana that you're talking about, or THC specifically. And the marijuana vape products look very similar. I'm not going to go into that. We do know all about these high concentrations causing lots of health problems, including damage to the brain and loss of consciousness. We'll talk further about that. Just show you a bunch of pictures now, over 450 e-cigarette devices. First ones came out looking like pipe cigars and cigarettes. I like to point out this one, for any of you who have asthma or COPD, this just looks like your inhaler. I have asthma, and my Ventolin rescue inhaler looks exactly like that, but that's made specifically for actually inhaling marijuana. The third generation, as I said, and fourth generation use nicotine salts. The first two generations use free-base nicotine, which is what's in combustible cigarettes. But the problem was they couldn't get, with the being not heated as high as something that was burned, these things that were turned into aerosols couldn't get as much nicotine to the brain as a combustible cigarette. So one cigarette gets about 1 milligram of free-base nicotine to the brain, which causes all the things we talked about. And for nicotine salts, you need about probably about 25 to 30 milligrams per cc. That's still being studied, so 20 times more. And even 1 milligram of nicotine from free-base nicotine from a cigarette is very harsh on your throat. It tastes bad. And to make it easier to get in, they acidified it and they added flavors. And they're then not as harsh, and it's much easier to take, and therefore much easier to get addicted. And what the Juul people did, I don't like this slide as much as the next, but you see a bunch of different percentages of acid they use. They found 4% of benzoic acid, made the purple line there. So the original e-cigarettes that used free-base were the powder blue line and the green line. A regular combustible cigarette is the mustard colored line, and the purple line is what they came out with and sold in this country, the Juuls that had 5% e-juice. 5% doesn't sound like much, but that's 56 milligrams per cc. You get just as much nicotine to the brain almost as fast, but you couldn't control the dose, unfortunately, and still can't from e-cigarettes. And then others came out and they had much more. So one Juul pod was 20 to 40 milligrams of nicotine, so 1 to 2 packs of cigarettes. The Sorani juice has as much as 3 or 4 packs of cigarettes to fill up one cartridge in their refillable cartridge. So the bottom line is more nicotine, more smoking. Study from a year ago or from a few years ago showed us kids who vaped and had never smoked were 4 times more likely to go on to smoking cigarettes. A study more recently from a year ago, a meta-analysis showed that kids who never smoked and only vaped were 3 times more likely to go on to smoking combustible cigarettes. And so as the tobacco executive said in the 90s that they said under oath that cigarettes were not addictive, only their profits were. And here's actually a picture of them in the 90s on the left of the CEOs of the 7 major tobacco companies swearing that their products were not addictive, yet their own documents when they were later released showed that they knew that they were. And on the right are vape company CEOs from just a year ago swearing in the same room that their products were not being aimed at youth, but only at adults to help them quit smoking. But you're going to see some of the flavors, and they're totally aiming at youth to get another base of customer base. And why is vaping different? One thing is the therapeutic ratio is gone. That means they can get their hit of nicotine with the nicotine salts the way they've made them, but they can't control it. So you actually can get nicotine toxicity on the one hand, and on the other, the withdrawal is more intense and lasts longer. So they are harder to get off, harder to help them quit. And here's just a statement from a 14-year-old saying he used to get a buzz and now it stopped. And what the kids did is they made up a whole bunch of things depending on the device, like for Juuls, it was called blinking, but French inhaling and stacking and ghosting so they could get their nick hit. But unfortunately, their nick hit was very close to getting nick sick, which included stomach pain and dizziness and headaches and decreased concentration, all the things we've talked about. So we know that nicotine is unsafe for young people, and it causes all of the brain changes, the addiction and behavior changes, and dual use. That's the difference on this slide. At least 20% of kids who are vaping are also dual using, meaning combustible products. 90% of them are cigarettes. So nicotine is indeed a brain poison. And just a few slides before we finish this section is why do kids vape, marketing, flavors, and advertising. A lot of this is taken from cigarette companies. This is from the 90s. Advertise to get kids to start, make them accessible, easy, and cheap to get them addicted, and then make them feel comfortable saying it's not going to harm you for a long time, if at all. And they use romance, rebellion, independence, all the things listed here, including easy and cheap. But what the vape people did that's new is they're also using flavors, cool technology, and social media. Now, the latest with puff bars is TikTok. So we were up against cigarettes before. We were up against Juuls for a few years, from 2016 to 2019. And then starting last year, we're now up against disposables, and here are puff bars. The original advertising, here's cool cigarettes for Black folks because it's a menthol cigarette in the 90s. Here's a Juul ad from now. They didn't even have to go to an advertising company. They just copied what they did years ago. And they say they're not advertising to kids, but here's actually get vape presents for back to school. And you have flavors like maple and maple pancakes, and you have and vanilla, and you have Curious George Smurfs and Daisy Duck and crayons. Are these ads for adults? You can answer that. And here's what some mods look like. Here's what tanks on the right hand side and a Juul looks like, and I put down a Sorin eye drop in the center, and they come very high tech looking, packed very much like iPhones. And here are the Juul 2.0s because there's no regulation in our country that is implemented as yet. Here's one I wanted to show, Vaporware, that's spelled correctly. That's a company that says Their delivery system is ready, meaning it's compatible with virtually every vape. They make a hoodie with a drawstring that you can very surreptitiously draw your vape aerosol through so that you can get your hit all day long without the teachers knowing. And then Christmas of 2019, they made a glove that had a attachment. You could fit your Juul or your now puff bar in. It fits perfectly. And then last Christmas, a few months ago, they had a watch that's really a vaporizer, but it looks like a smartwatch. And then here are some big twos of the disposables. They all came out literally within 2 to 6 weeks of the flavored cartridges coming off the market, as I showed you at the beginning. And here are some stores that they're high-tech stores. These are not back of the, behind the counter stores. They look, and they're all over our state. They're really high-tech. They're neat looking. They're cool. And flavors, here's just some other flavor names, over 15,000 flavors. Booger sugar, banana butt, honey doo doo, Barney Pebbles. Are they advertising to adults? And adults, we do like flavors, but this is one of many studies that show for 12 to 17-year-olds, the primary reason from the advertising they wanted to try these things, they were cool, the technology, but also they tasted good. And these do taste. So in summary, tobacco products to me are the number one public and population health issue, and nicotine is the number one source of nicotine. Nicotine is the gateway substance. Comprehensive community programs work. Despite all the technology, and maybe that's because I'm old, I'm not into the technology, but it's not just me. The two major public and population health achievements in the 20th century were comprehensive community programs to stop tobacco use and vaccines. And I think they're going to be the same for this coming century, because we still have a lot of kids smoking. 100 million deaths in the 20th century. If we don't do something, 1 billion deaths this century. This is from Southeast Asia, where kids smoke even earlier than here. And we can end with that. We just need the political will, and I'll stop there with